I would like to thank you all for joining this special interaction. I especially thank our friend Prime Minister Oli, who has joined us almost immediately after his recent surgery. I wish him a speedy recovery. I would also like to congratulate President Ashraf Ghani for his recent re-election. I welcome the new Secretary General of SAARC, who is also with us today. I also acknowledge the presence of the Director of the SAARC Disaster Management Center from Gandhinagar. Excellencies, as we all know, COVID-19 has recently been classified by the World Health Organization, WHO, as a pandemic. So far, our SAARC region has listed fewer than 150 cases, but we need to remain vigilant. Our SAARC region is home to nearly one-fifth of all humanity. It is densely populated. As developing countries, all of us have significant challenges in terms of access to healthcare facilities. Our people-to-people ties are ancient, and our societies are deeply interconnected. Therefore, we must all prepare together. We must all act together, and we must all succeed together. Excellencies, as we prepare to face this challenge, let me briefly share India's experience of combating the spread of this virus so far. Prepare, but do not panic has been our guiding mantra. We were careful to not underestimate the problem, but also to avoid knee-jerk reactions. We started screening entry into India from mid-January itself, while also gradually increasing restrictions on travel. The step-by-step approach has helped avoid panic. We have increased our public awareness campaigns on TV, print and social media. We have made special efforts to reach out to vulnerable groups. We have worked to quickly ramp up capacity in our system, including through training our medical staff across the country. We have also increased diagnostic capabilities. Within 2 months, we moved from one major facility for pan-India testing to more than 66 such labs. And we have developed protocols for each stage of managing this pandemic. We also responded to the call of our people abroad. We evacuated nearly 1,400 Indians from different countries. We also similarly helped some of the citizens of our neighboring countries. We have now built A protocol for such evacuations, including carrying out testing by our mobile teams deployed abroad. We fully recognize that we are still in an unknown situation. We cannot predict with certainty how the situation will unfold despite our best efforts.
We are into unknown territory, and our vulnerability, Excellency, comes from our openness. Our greatest vulnerability is that we have an open border with Iran, one of the major centers, and the flow cannot be stopped. And the province of Herat is become the central node for preventing the spread and diffusion of this deadly disease to the rest of South Asia. I have the following 5 proposals. 1, modeling of diffusion impacts and scenarios for management. Unless we model the diffusion, we will be facing assumptions from China or the United States or Iran are not suitable to our situation. I request the task force of SAARC to be able to do this. Second, telemedicine, because the second and third order impact of this, particularly on poor and vulnerable and women, is very significant. If we could create a common framework for telemedicine for diagnosis of related issues and as advances take place, how to be able to coordinate. Third, as a landlocked country, which is simultaneously the heart of Asia, closing of borders where essential will result in significant problems regarding availability of medicine, food, and basic goods. Can we coordinate to be able to create controlled flows?
Our priority now is to use precautionary measures to contain the virus as much as possible so as not to overburden our limited resources. The unique geography of the Maldives will always present itself both as an opportunity as well as a challenge. The dispersed islands make it easier for us to isolate communities whenever there is a suspected case. But in the event that a person tests positive in the outer islands and is seriously ill, requiring specialist care, the person has to be transported to the capital, Male. This is extremely costly and puts enormous pressure on an overstretched team of healthcare workers. Our tertiary hospitals in the regions are currently under development. Shortage of healthcare professionals in general and shortage of specialist doctors in particular are always major challenges, and in a crisis such as this, these challenges are several times greater. The Maldives is fortunate to have received general assistance from India, and I convey my government's appreciations to Prime Minister Modi and the people of India. We have received medicine and a visiting medical relief team to work with Maldivian healthcare professionals. Excellencies, in the Maldives, the virus is showing in the most destructive fashion the country's vulnerabilities to external shocks. Any significant decline in tourist arrivals has a ripple effect on the Maldives economy. Tourism contributes over a quarter of the country's GDP and is the source of well over 2/3 of foreign currency to the country. every other job creating and revenue generating activity in the country is either directly or indirectly dependent on the tourism industry. Our industry is also deeply linked to many businesses and supply chains within SAARC region who will feel the knock-on effects from the downturn in the Maldives. We should create space for closer cooperation between the health emergency agencies to ensure that the countries in SAARC have unhindered exchanges of information about the virus and best practices. Second, there is a profound need to formulate an economic relief package targeted to the affected countries. Third, a comprehensive regional strategy to fight COVID-19 should include a long-term recovery plan for the region.
Our biggest challenge is to stop or minimize the virus entering into Sri Lanka and control the spreading of the virus within. We did this following the guidelines and statistics relating to the spread of the virus issued by the World Health Program Organization. We have also taken steps because we have a large number of Sri Lankans working especially in Italy and South Korea. We cannot stop our Sri Lankans coming back to their home country. We have therefore taken all steps to subject those returning to Sri Lanka to a 14-day quarantine period in selected quarantine centers. Because of these reasons, our economy has taken a severe blow due to the coronavirus, particularly in tourism. Most of our tourists are from Italy, Germany, and other EU countries. And now there is a ban on their coming. Our tourist industry was just recovering after last year's April 21st terrorist attack. Our exports are also adversely affected. Therefore, I strongly recommend the SAARC leaders to formulate a mechanism to assist our economies to tide over this very difficult period. I also wish to recommend that a SAARC ministerial level group be established to discuss, share best practices, and coordinate regional matters on combating coronavirus.
We need to devise a strong SAARC-wide strategy to fight this public health threat and to protect our citizens. We successfully prevented entry of the virus through strong surveillance and rigorous checkup at all international airports, sea ports, and land ports. As of now, we had only 3 COVID-19 imported cases. They have already recovered. There are 2 new imported cases from Europe. We have no local or community transmission of any COVID-19 case. I have some proposals that all SAARC countries need to cooperate and collaborate closely to fight this pandemic. We need to force collaboration through our collective capacity, expertise, and resources. We are ready to share our capacity and expertise as well as the best practice with the SAARC countries, including providing logistic support if required. To continue this dialogue at technical level, our health ministers, health secretaries, and relevant health experts can also have this kind of video conferences to discuss specific areas of cooperation. WHO Southeast Asia Regional Director may be invited to these video conferences. We believe it is extremely important to establish an institution to prevent and fight against any public health threats in South Asian region in future.
Our region is at high risk of COVID-19. The epidemic knows no boundary, no nationality, and no region. Therefore, we need to devise ways to combat this pandemic collectively. It is a common challenge and it demands common efforts. First thing is awareness creation. Community-based organizations and medical and non-medical volunteers could be mobilized in raising awareness and supporting government agencies. We have to appeal to our people to avoid non-essential foreign travels and to avoid attending mass gatherings and other large-scale events. Our region is rich in traditional medicine. We have to encourage our people to use this asset for the prevention and treatment of this disease. Our way of greeting people with namaste rather than shaking hands can avoid potential threat of women-to-women transmission of this virus. I believe that our region holds a good stock of emergency medical supplies, well-trained medical professionals and laboratory facilities. These would be deployed at the call of any member state of SAARC in urgent need. The hospitals in the bordering areas could also be utilized for the screening as well as treating infected patients coming from across the border.
Togetherness is required at all times, but when the whole world is fighting one common disease that we cannot see with our naked eyes, I think it's very important that all of us come together and leave behind our differences. And number two, I think it is very important that we communicate very clearly on this. Communicate between all the leaders of the world, communicate between central government with local government, communicate with the health planners and the people of the nations.
The COVID-19 pandemic is one of the most serious global health emergencies witnessed in the last 100 years. At the same time, when it has been characterized as a global pandemic, it is deemed controllable as well, provided timely and appropriate public health measures are put in place. The COVID-19 pandemic forces us to think not in terms of nations and states, but as a collective. If our health systems, disease surveillance systems, and preventive measures are unable to cope, the human and economic cost alone can be staggering. The cumulative impact will dampen region-wide growth prospects and negatively affect the national development agendas. At their current stages of development, the SAARC members can ill afford such a setback. The unprecedented challenge therefore warrants an unprecedented response. We must recognize that the national and local responses still remain the key and they are the most critical. It is equally important to pursue, however, evidence and science-based responses. Stigmatization and stereotyping is counterproductive. The SAARC Secretariat is best placed to coordinate regional endeavors. With this in view, Pakistan proposes, like other excellencies, that the SAARC Secretariat be mandated to 1. Establish a working group of respective national authorities for health information and data exchange, as well as coordination for responses in real time. And two, like His Excellency President of Maldives and Her Excellency Prime Minister of Bangladesh, Pakistan would like to reiterate its earlier proposal of hosting SAARC Health Ministers Conference at an appropriate time. Three, reach out on behalf of SAARC countries to specialized development partners, including World Health Organization, for mobilization for technical advice and resources. Four, follow WHO guidelines and implement exit health screening for travelers in the region to avoid cross-border spread. Five, a regional mechanism is proposed to share disease surveillance data in real time about prevalence and incidence of communicable diseases and public health events of regional significance.
We have to work together. We can respond best by coming together, not growing apart. Collaboration, not confusion. Preparation, not panic. In this spirit of collaboration, let me share a few ideas on what India can offer to this joint effort. I propose we create a COVID-19 emergency fund. This could be based on voluntary contributions from all of us. India can start with an initial offer of 10 million US dollars for this fund. Any of us can use the fund to meet the cost of immediate actions. Our foreign secretaries, through our embassies, can coordinate quickly to finalize the utilization of this fund. We are assembling a rapid response team of doctors and specialists in India, along with testing kits and other equipment. They will be on standby to be placed at your disposal if required. We can also quickly arrange online training capsules for your emergency response teams. This will be based on the model we have used in our own country to raise the capacity of all our emergency staff. We had set up an integrated disease surveillance portal to better trace possible virus carriers and the people they contacted. We could share this disease surveillance software with SAARC partners and training on using this. Let us also use existing facilities like the SAARC Disaster Management Center to pull in the best practices among all of us. Looking ahead, we could create a common research platform to coordinate research on controlling epidemic disease within our South Asian region. The Indian Council of Medical Research can offer help coordinating such an exercise. We can also ask our experts to brainstorm on the longer-term economic consequences of COVID-19 and how we can insulate our internal trade and our local value chains from its impact. Finally, this is not the first nor the last such pandemic that will affect us. We can also ask our experts to brainstorm on the longer term economic consequences of COVID-19 and how we can insulate our internal trade and our local value chains from its impact. This can help to prevent such infections from spreading across our region and allows us to keep our internal movements free.